Good afternoon, everyone. My name is Troy. Today I will be discussing the Copley Hospital capital budget. So, Copley Hospital is a small hospital located in a small town in Morristown, Vermont. They offer many different services inpatient and outpatient care, emergency care. They have a birthing unit, ortho floor, rehab, and more. So, what we're looking at is the capital budget plans for Copley Hospital. This year, they're planning on spending 3.5 million, mostly due to the radiology department that they want to renovate. They have 340,000 going to other floors within the hospital. So this is for like renovating rooms on the PCU, the med surge, um, OB, labor and delivery. The 1.2 million will be just for the MRI department, radiology, getting new X-ray machines, and helping out staff and training them. This page goes more into depth of where the money will be going. So $2.7 million will be going to MRI equipment and construction. 1.2 million will be going to upgrading the MRI and space renovation. 1.4 million will be going to new MRI equipment. 500,000 will be going to new X-ray equipment because they've been having trouble with the sending out images. That is very important because that delays patient care and delays results. 250,000 will be going to plant property acquisitions. 246,000 will be going to plant infrastructure improvements. So this will be like your fire department connection relocation, negative pressure room assessments, existing conditions to be decommissioned or demolished. They have 150,000 going to new ultrasound machines and 141,000 going to new cardiac monitors. So we're going to speak about the capital budget analysis. So the budget increased 1.2 million from the previous year. Basically, as we discussed, they want to renovate the radiology department, bring in new MRI machines, new X-ray machines. They also brought attention to the need to renovate the radiology room, as they often have problems sending out images. Like I said, due to this, patients could experience delays in receiving diagnosis and treatment plans, potentially leading to profound discomfort, uncertainty, or progression of their condition. Now I'm going to talk about the role of the budget. So the budget is to make sure that money is going to the right place. So this budget plays a crucial role in allocating resources for major investments in long-term assets such as the hospital renovations, radiology equipment, and technology. It helps prioritize and plan for essential infrastructure, upgrades, expansion projects, and large equipment purchases to support the hospital's strategic goals, improve patient care, and maintain regulatory compliance. These four individuals who are the ones will be creating the budget. Joseph Woodwin, who's the administrator, Jeff Hebert, who's the chief financial officer, Donald Dupis, who is the chief medical officer, and Kathy Damaris, who's also a nurse and a board on the chair. Now we're going to discuss the process in creating the budget. So first off, you have to assess the needs of the unit or the hospital as a whole. The delays of the imaging process was the first problem that was discussed when creating this budget plan. There was also a discussion about the need to renovate the hospital, especially the radiology department. The next thing they did was plan. The next step in the process was aligning capital investments with the hospital's strategic goals and long-term vision. Next, you prioritize. Prioritizing capital projects based on urgency, impact on patient care, and return on investments. Then you want to do your cost estimation. So how much everything's going to cost. That's when you're going to contact your stakeholders, your donors. So estimating the costs associated with each capital project, including construction, equipment purchases, installations, training, and ongoing maintenance expenses. Now we're going to talk about the process. So first, you're going to do an internal review and approval. This is when hospital administration and relevant stakeholders review and approve the proposed capital budget. Then you want to communicate the plan and development. So then a communication was developed outlining key messages and timelines for sharing capital budgetary decisions. And then you debrief with the department. So department heads and managers communicate capital budget decisions to their respective teams, providing context and answering questions, and addressing concerns to ensure staff buy-in and collaboration. And then most importantly, you have your stakeholder engagement. So external stakeholders were included, such as patents, community members, donors, and regulatory agencies through newsletters, website updates, public meetings, highlighting the hospital commitment to improving patient care and health, community health. So starting off with recommendations for improvements. So the 141,000 for the negative pressure room assessment should be raised. Negative pressure rooms are essential for containing airborne infections such as COVID-19, tuberculosis to prevent the spread of pathogens to other patients and healthcare workers. We can do this by moving the 25K from the fire department relocation and investing it in the negative pressure rooms, as this is more important at this time. Although we're spending $2.7 million to renovate the radiology department, we also need money to train new staff. We're also going to get new staff in, so we need more money to hire new staff. So we need money to train current staff on how to use the new technology, and we need money to hire new staff because we're going to have a bigger radiology unit. So, a specific recommendation I would like to make to the radiology department is implementing initiatives to enhance the patient experience, such as improving communication with patients about procedures and providing amenities to enhance comfort during imaging studies. And there's always room for improvement when it comes to infection control. So this is important, prevents spread from patients to patients and from patients to staff and staff to staff. So ensuring compliance with infection control protocols, including proper cleaning and disinfection of imaging equipment, adherence to radiology, enhanced to radiation safety guidelines, and implementation of protocols to minimize the risk of healthcare associated infections in the radiology department. And then, most important, we also want to continue quality improvement, establish a culture of continuous quality improvement within the radiology department by soliciting feedback from patients and staff, conducting regular performance assessments, and implementing data driven quality improvement initiatives to drive ongoing enhancements to the department. And then the scenario. So to meet the budget for the next fiscal year, I would prioritize spending the additional 341,000 on building improvements and put it towards staff, like giving raises, bonuses, hiring new staff so we can have a lower patient ratio. Additionally, this will increase staff morale and help retain staff, and patient safety would increase tremendously. We would also see a reduction in patient safety events and falls. This will also increase patient satisfaction scores.